Thank you very much indeed, Chikwe. Thank you so much for inviting me to Nigeria. I've lived in sub-Saharan Africa for 14 years, and no one ever invited me to Nigeria. I was feeling heartbroken, but I'm here now, and if it makes you feel any better, Femi, you say you've been here for less than 12 months. I've been here less than 12 hours, so I'm brand new. But I'd like to talk to you about universal health coverage. We were asked to talk about big ideas, and they don't come any bigger than this. And really to try and enthuse you to think about the time is now for universal health coverage in Nigeria. I think you've got a wonderful, wonderful opportunity. I should explain that I'm actually at Chatham House now, the think tank, where we run a small unit specialising in the political economy of universal health coverage reforms, recognising that big, massive health reforms are really more political than they are technical. And so therefore it's vital to aim right at the top, the head of state, and try and enthuse them about universal health coverage reforms. So I'm just going to explain now what I mean by that, and perhaps give you one or two examples of some countries that have taken this step recently. So first of all, what do we mean by universal health coverage? And this is a simplified definition that all people receive the quality health services they need without suffering financial hardship. Now, if you unpack that a bit, it's all about equity, fairness, social solidarity. So you'll see why it's so political. First of all, universal means all, everybody. No one is left behind. Then you see the bit about the health services, the health coverage. It's health services allocated according to need, recognizing that some people need more services than others. So, for example, pregnant women and children, elderly people, they get more health services or ought to get more health services than people who are relatively healthy. But also there's this vital element about the financial protection, people not suffering financial hardship when they're accessing healthcare. And we recognise a lot of this healthcare is very expensive. So this automatically means that the health sector is financed according to people's ability to pay. Rich people pay a lot, middle class people pay a little less, poor people pay next to nothing, and people with literally no money at all should pay nothing at all. Now, you combine those two elements together and you get this very profound meaning out of universal health coverage. It's all about healthy, wealthy people cross-subsidising sicker and poorer people. And really this is a great thing for societies to do, and across the world this is what's happening. But the financing of this is crucial, and this is the important point to make here, that a purely privately financed system, like you might buy a microphone or a light bulb or something, will never ever reach universal health coverage. It has to be publicly financed, predominantly. I'm not saying exclusively, there might be role outside of that. But what the world is learning, and all the big agencies are saying now, WHO, the World Bank, DFID, but lots and lots of governments are recognizing that the key to universal health coverage is progressive health financing. And this is because the market will never deliver it over its own right. One country that's quite famously has got a private insurance system, next slide please, I'm not sure how clearly you can see this, is the United States. And I put here, this, I'm not sure you can read the text here. This is one poor guy who was really sick, had no money, and the only way that he could get health care was to commit a crime to get arrested so that he could get state-funded health care. Now, believe me, this is no way to run a society, and you do not want to go down this route. And what the Americans are learning, like countries across the world, is that you never reach universal health coverage through private voluntary insurance. It has to be compulsory, it has to be state-run. Social health insurance, okay, but not private voluntary insurance. Next slide, please. Now, I'm from the UK, so you're bound to have this, that The UK, we have a publicly financed system out of general taxation, and we're very proud of it. This slide, you can't see it particularly well here actually, but this was the Olympic Games. I'm not sure, do you remember when London had the Olympic Games in 2012? Well, this is an aerial shot of the stadium where they painted out the National Health Service. And this was, a lot of us felt very good about this. That this was one of the things that Britain, we felt, had done well and that other countries might want to learn about. I must say, American TV stations were completely bemused as to what on earth is this? They couldn't understand this, but everyone in Britain knew it very well. And we love our National Health Service. It's one chancellor once described it as the closest thing that the British have to organised religion. Is the National Health Service. But, we recognise it's a great thing. So, next slide, please. And the point I want to make, really, is that taking that step to universal coverage, everybody being covered, is highly political. Because it has to be done out of public financing. It has to be done by forcing healthy, wealthy people to pay more. But politicians that take that risk and do it become national heroes. 2 examples here. Tommy Douglas, who was the architect of the Canadian health system, he was voted the greatest Canadian ever in history. This is Nye Bevan, who is the founder of the National Health Service, who was our health minister at the end of after the Second World War. And there's a big campaign going on at the moment to have his picture on the back of the £20 note. We put all our heroes like Wellington and all these people on the back of the £20 note, and people are saying it should be him next. But there are other countries as well. Next, please. Now, some more recent examples, and you might think more relevant to your situation. Middle-income countries that have taken this giant step forward. This, if you don't know, is the former Prime Minister of Thailand. And interestingly, the reason he's holding up this football shirt is that at one time he was the owner of Manchester City Football Club, which is quite interesting. But as well as owning a Premier League team, he introduced universal health coverage to Thailand in 2002, when Thailand's GDP was $1,900 per capita, about 2/3 of what Nigeria's is now. So don't let it be said Nigeria can't afford universal health coverage. Thailand did it in 2002. I should say that the NHS came in at the end of the Second World War. I just looked back today to see that in 1972, our GDP was the same as Nigeria's today. So we'd had the NHS for 26 years by then. So again, it's perfectly affordable. And what they did there, and just stay on that for a second. What they did in Thailand was to scale up coverage by giving everyone in the informal sector a card, entitling them to publicly financed health services. And they put about 0.5%, 1% of GDP into the health budget to do that. Next. And it works at all income levels. And you look what President Obama is doing in the United States and the amount of political capital he's put into reforming the American healthcare system, which everyone recognizes is woefully inefficient and really inequitable. About 30 million Americans don't have health insurance. And what he's done through the Obamacare laws is made health insurance mandatory. 5 presidents tried before him to do that, they all failed. And I think history is going to judge Obama really well as the person who took America towards universal health coverage. I've got one more example here now. This is a fascinating one, which I think is highly relevant to Nigeria. This is the new president of Indonesia. During the presidential debate, live on television, announcing that he was going to give everyone one of these cards, entitling them to universal free healthcare in Indonesia. Indonesia's GDP is virtually the same as Nigeria's. So again, this affordability thing. And he's financing this out of reducing fuel subsidies. He knows that reducing fuel subsidies will be unpopular, but he's sort of making this deal with the population. You get free health services, but you're going to have to pay a bit more for your gas. And this works. So I know the Nigerian government has always been thinking about how do they reduce fuel subsidies. Spending it on quick win health things is a smart idea. And I should say, I've written a couple of papers about this recently for the Lancet and for the WHO Bulletin. that we should be really thinking about this, because you can imagine as a head of state saying, oh, well, I'm going to reduce fuel subsidies and I'm going to build infrastructure and electricity and everyone's going to have jobs. And the population are a bit skeptical about that. They think, oh, it's going to take decades for this to affect me. But if you start providing basic free health services across the entire country in a quick period of time, people see the benefits quickly. So politically, it's a smart thing to do. So my last slide, and this is the big question, and I'm sort of amazed that I've hardly heard his name mentioned today. But at the end of the day, UHC in Nigeria depends on the president. There's no doubt about it. We're all convinced, of course we're all convinced, but to get that money out of the Ministry of Finance is going to be a struggle. I don't know many ministries of finance that say, oh yeah, let's double health budget tomorrow, no problem at all. They have to be told to by the head of state. And my recommendation for all health activists is in pitching this to the head of state, as well, of course, of emphasizing the health benefits about people living longer and the economic benefits. Don't forget the political benefits. Basically say, look, this will turn you into a national hero. And say maybe if the president was seeking a second term, like an old wine wanting to get even better into the future, universal health coverage, maybe financed out of fuel subsidy reductions, honestly, I think is the answer. Thank you very much. Thank you.